focusing on the easiest, it's the easiest building block in research, which is the case report or clinical vignette. So this is going to be the one most manageable for basically everyone, and whoever is interested in starting a research will be doing a clinical vignette, and that's the way I would recommend you starting off in research for most of you who are clinically oriented. Of course, if you are a research oriented, you might start working or participating in a huge trial, and that might be your first encounter. But for most of us, research will start off with a case report. So I just wanted to share some information as to what's the importance of the case report. So number one, why do you want to present this case? So the answer is interesting. That's the word. It is interesting. There's something interesting about it. What is interesting about it? It can be a barrage of things. So is it the diagnosis? Is it a new way to diagnose something? Is it something, one second, I'm gonna log out of this real quick. Is it something that has to do with the treatment for a patient? So was the treatment special in any way, right? Regarding can patient care improve based on what you saw in a certain patient? Can we avoid doing a certain thing in medicine and actually improve outcomes? So I'll just give you an example, which is pericardial decompression syndrome. So if you haven't heard of it, yes, it's probably because it's quite infrequent. But when you have a patient with pericardial tamponade, and that tamponade has more than 500 cc of fluid, maybe let's say it has 800 cc, and the patient has tamponade, the usual answer and the intuitive answer is we have to take that out. So the patient goes, gets a pericardial window, gets it drained, and you drain all of it. Most of us would think that is great. Okay, we got rid of the problem. But if you understand the physiology, the pathophysiology, and the term pericardial decompression syndrome, you might be like, I think this patient should go to the ICU because we're in for a treat. Because when you take out more than 500 cc from the pericardial space at a time like this, then you can have the decompression syndrome, where it will alter all your hemodynamics and your patient can go into cardiogenic shock. And the weird thing about it is that the patient is in shock, but there's no effusion. There's no pericardial effusion. The patient should be doing great, but is in shock. So that is interesting. So if you go through the internet and you type in pericardial decompression syndrome, you can see several clinical abstracts about this, maybe 4, maybe 5, an easy search. And many of these abstracts aren't that old. We're talking about within the last decade, most of these abstracts. Why is this? Because it started off with abstracts, with clinical case reports, and then several of these case reports became presented more frequently, and suddenly you have this new term, and yeah, it's very interesting. So maybe a case of pericardial decompression syndrome nowadays could still make it and be something interesting to talk about. So you get the point. It has to be something interesting, something that people usually don't have in their minds. Not the usual, you treat diabetes with metformin and everything went well. That's not going to be interesting. What's the clinical pearl? So that's the question. What can people take from your presentation that might actually change in some way or form the management of a patient in the future, right? So that's how these hypothesis generating thoughts occur. So that's the importance of the clinical vignette. So there's different subtypes of clinical vignette. I think we might have here the explanation, but we'll see that shortly. So basically, number one is, why is this interesting? So when you have an idea, run it through people, because I've seen medical students be like, oh, this is so interesting. A patient with Lyme disease. So this is so interesting. I've never seen it. Can we do a case report about that? So, well, Lyme disease is already well published. We know what Lyme disease is. If you are just learning what Lyme disease is, it doesn't necessarily mean that it is worthy of a case report. Because if it's the usual presentation for Lyme and everything, textbook Lyme disorder, probably won't make sense to publish. But if you tell me, well, yeah, this patient has Lyme, but I'm not sure about how the diagnosis was made. Because actually the diagnosis was made, the patient got an IgG antibody, which was positive, but the IgM was negative and has been having headaches, was started on doxycycline, was given doxycycline for 2 weeks. It didn't improve the headache, which is the treatment of choice for Lyme. The patient then went to see a neurologist. They gave him more doxycycline for another 2 weeks. The patient kept on having actually now worse headache and nausea and vomiting. And the patient started, because of the headache, taking aspirin and acetaminophen every single day. And the headache was worse and got a lumbar puncture, which didn't show anything special. So could we actually make a case report about this? So what's interesting about this? Maybe the initial diagnosis of Lyme wasn't even Lyme disease, and this patient had Lyme disease. The Lyme disease got cured, but the patient now has medication overuse headache. Oh, that's interesting. That's more interesting, right? So, okay, how can we actually frame this that would actually make sense and would actually be interesting for people, okay? The other point, as I mentioned, the word frame, I do not mean frame as in making up things. never make up things, because this is very serious and this might alter the way we practice medicine in the future. We never know. Remember that for Alzheimer's disease, someone sort of doctored or faked a little Western blot, and that could have changed millions of dollars and billions of dollars that has been put into research of medications that would affect the plaques and tangles to a certain extent, right? I'm not saying that it completely or it did a major change, but that is, just don't try to fake things just to publish things. If that's the case, it's better not to publish, because the idea is that you feel strongly about what you're publishing and you're very interested in this new findings you have. So the idea is that when you're presenting a case report, you're in front of that case report, in front of that poster, with a smile on your face and waiting for people to ask you about it, because this is so interesting to you and this might actually generate some new finding or affect medicine in the future. Okay, so now we know how to decide what is worthy of a case report and what might not be worthy. Step number 2 will be basically, title and author information. So your title, you can, for example, for pericardial decompression syndrome, let's see, I actually did one of these, and you can just say pericardial decompression syndrome association with cardiogenic shock. Like, who's gonna be interested in it? Yeah, it sounds interesting because you maybe have never heard this term, but make it sound nice. Like, it could be the fatal dance between tamponade and pericardial decompression syndrome. That sounds better, right? You want to also attract attention to your poster, and you have put in a lot of time. So if it sounds a little poetic, it's okay, but it has to make sense. It has to click in the person who actually listens to you talk about it. The title has to make sense, and the title has to have the main point of your case report within it. So in one liner, in 5 to 10 words, your whole explanation, your whole presentation has to make sense with that. Because I've also seen case reports where the title is one and you end up actually the focus of the case report is totally different. So in the end, it's not a good idea to do that. Author information. So the authors, usually in a case report, 4 to 5 authors. I think what I have seen is that 5 authors is like the most, but there's no like hard limit to it. I would say maybe 5 or less. It would be my general recommendation. The authors, include people that actually participate, that are highly enthusiastic with the work, and I'll talk to you about it in the next video, how we will probably organize these things and streamline them in the future. So then we go on to the introduction. So the introduction, typically describes the context of the case and explains its relevance and importance. However, is perfectly acceptable to begin directly with the description of the case. Okay, so I didn't know that. I thought all abstracts had their introduction, but maybe you have something so complex you have to go directly to the case description. I would recommend you always doing some sort of introduction, right? So for example, if you have an interesting case with a patient who was in the hospital because they had a lightning strike, and they have even the red Fernin pattern, which is called a sign. I don't remember the name of the sign of the red Fernin pattern. And the patient had acute kidney injury, which then resolved and all that. It could be an interesting case report. So in your introduction, you would probably talk about lightning strikes. You would probably be like, in the United States of America, lightning strikes, this is like the prevalence per square mile. Southeast United States averages this amount of lightning strikes versus this one. Such amount of people is hit by a lightning strike in the world yearly. Such of this amount make it alive. This amount have a kidney or target organ damage. This and that, and then you go to your case description, right? And then right before your case description, you finish off saying, this case will demonstrate X or Y, or this case, you have to give them some sort of clue, like, what is this case going to do? And then comes the case description, right? So on the case description, this is the same as saying patient presentation. So here you will give the main features of your patient you are talking about. So you'll describe the history, physical exam, relevant studies, be it laboratory imaging, and patient progress and outcome. So that's the trick. The trick is to be complete without obscuring the essence of the case with irrelevant details. So I can't stress that enough. This is one very point made by one of my tutors / mentors, which was no medical jargon, because this person told me, this is sounds like a great college essay, university essay, but this doesn't sound scientific, like medical literature. Medical literature is more scientific. It's more to the point. It's less medical jargon, less poetry / essay, like essay-ish. Then you go to the discussion, and this usually is the most important part, because this is where all your reasoning happens. So the main purpose is to extract the lesson from the case. Not uncommonly, reports from the literature or their absence are cited that either directly support or contradict the findings of the case. So I'll give you an example. I had another case with a metastatic pheochromocytoma, which actually would be called metastatic paraganglioma. Well, based on the location this tumor was in. And it produced refractory cardiogenic shock But what was interesting is that the cardiogenic shock associated with pheochromocytoma, there's type A and type B. This patient presented like a combination of both. And what was interesting with this case was that when you have a patient in cardiogenic shock, you usually start them off on the vasopressors, inotropes, all these things. But this is one of those exceptions that the literature still hasn't figured out. The scientific community still doesn't have a clear plan for. There is no guideline as to how to treat a metastatic pheochromocytoma that you cannot like operate or surgically remove. There are some options, but it's not easy because these are case reports and they are isolated. So first they have to study the case series. So we're at that point in time, but you cannot do a randomized controlled trial with something that happens so infrequently. So the interesting thing was just to propose or to present this case, and this will become part of the general medical literature about metastatic pheochromocytomas, and maybe it can lead to a proposed treatment in the future. So what was interesting, it was that the patient actually worsened with the inotropes and vasopressors, so it was a fine titration of these medications, so it was very interesting. Okay, so let's go back to this. When writing the abstract, avoid the use of medical jargon and excessive reliance on abbreviations. Yeah, so when you're going to abbreviate, so the first time you write it out the whole thing, and put it in parentheses. So you can write down complete blood count in parentheses CBC. Next time around that you're going to mention a complete blood count, now you can put the abbreviation. That's like the general thing I've seen. Sometimes you can just write the abbreviation, but if it's something that is extremely common, such as CBC, right? Or WBC, white blood cell count, right? Okay. Typically takes several days to write a good abstract. Yeah, this isn't something that is the first draft and that's it. So I'm telling you, the last abstract I did was something that lasted like 7 to 10 days, and I thought I had it ready. I actually thought I had it almost ready by the time I showed it to this cardiologist that helped me out a lot, and he was like, no, too much medical jargon, you have to get to the point, this needs a lot of work, and he helped me out a lot, and I sent him 4 different drafts after that, and the final one was the 6th draft. And I had already worked on it before, so this isn't something that will happen overnight. I would recommend anyone working on an abstract to use Grammarly. There is a free one and there's a premium one. Grammarly will help you with all the grammatical things, right? I would also possibly recommend artificial intelligence, not to write your abstract, but to maybe give you some suggestions. Like you might write a paragraph and you're like, I'm not sure if this sounds correct. So use Grammarly and use artificial intelligence. And after that, go talk to your mentor, because you don't want to get your mentor exhausted before you get the final result, right? You want to also appreciate their time and effort. So that's about it as to what are the sections of a case report and what should go in a case report, why you should write a case report. So I think that's enough for this video, and next video I'll explain how we will streamline doing these case reports. Anyone interested in joining medical case reports, mainly in the areas probably of cardiology and critical care. I like medicine as a whole, so just let me know, but comment in the comment section below. Give me any feedback you might have, and yeah, great to see you on this one.